Hey, welcome to Blue Dream Health Collective, where we talk about real health as well as chronic illness, self-care, mental health, and other interesting and educational topics. I'm the host, Misty Blue, a biomedical science major and a chronic illness warrior. Thank you for tuning in, and I hope you love this episode.
Thank you so much for joining in on this conversation today with Dr. Laura, an Ontario naturopathic doctor who has founded the Period Passport online program to help women fix their period problems, as well as her Time of the Month, a monthly membership focused on getting women accurate information related to their hormones. Dr. Laura is passionate about helping others to live their best lives and reach all of their goals, which can be difficult without good health. If you're looking to become pregnant, fix your period, lose weight, improve your energy, or to create balance in your life, Dr. Laura can help create individualized treatment plans that are both realistic and sustainable. So, okay, enough from me. Go ahead and introduce yourself.
Thank you for having me. As you mentioned, I'm Dr. Laura Pfeiffer. I'm a naturopathic doctor, and I focus primarily on women's health-related concerns. I've kind of narrowed that in a little bit more to focus on pretty much only fertility and period problems. That's where my passion is women's health, hormones, and fertility and periods.
I love that. I feel like that is something I wish that I had this around like 10, 15 years ago. So what led you to become a naturopathic doctor with a special focus in periods and fertility?
Yeah, so I kind of growing up, I knew I wanted to be in the healthcare field. I grew up with a mom who's a nurse. So having an RN mom, I was always in the medical-ish type of field. We always had these types of conversations, uncomfortable conversations at the dinner table, I was always used to. And so for me, I knew I wanted to be a part of healthcare, but seeing how the healthcare system worked just didn't really make sense for me. So I wanted to be able to spend more time with patients, impact patients in a preventative way, in a way that wasn't just like emergency medicine type situations or taking medications for, I don't know, a symptom here, a symptom there, that sort of thing. So I ended up finding naturopathic medicine, and it actually wasn't until I started at the Canadian College of Naturopathic Medicine that I realized that hormones were going to be such a big issue for me. I started at the ripe age of 13 on birth control because I had acne like every other 13-year-old girl. And at CCNM, I was told that my chronic yeast infections could be maybe from the birth control pill. And I was like, oh, okay, no one's ever told me that that could actually be the reason. So discontinued birth control, and I can tell you I'm now 30 and I haven't had one since. So that was kind of part of the issue, was just not knowing, just not being informed. I had no idea what was going on with my body each month. And I found over the years, not many women do. And so it wasn't until I got off of birth control, my cystic acne worsened. My cycles were 70 days plus. I had irregular, painful periods. I was diagnosed with fibroids. And I just thought, like, I need someone to help me. Like, these are awful symptoms I'm dealing with every single month. And the conventional medical system didn't have answers for me. I was told to just go back on birth control. And that was really that's where my options started, and that's where my options ended. And so I going through school and using my own experiences and my knowledge and expertise, I kind of started just wanting to be on this mission to get women the education and the tools, because I was 22 before I was given the education, and I'm a doctor, and it was part of my school, and that's the only reason why I know. And so just kind of going back to getting women back to the basics, understanding their body, understanding that there's choices other than birth control. There is absolutely nothing wrong with birth control if it is used for birth control. But we're not using it for that. We're using it to treat things. And so that's kind of what led me to where I am today.
I love that. And that's so true. I feel like they don't really consider that, I mean, with females, we have our hormones, we have this chemical makeup, and it affects us in so many ways. And I just feel like that it's kind of underrated and under discussed when it comes to healthcare. So, today we're here to discuss period problems and fertility, which are such important topics that many find themselves hesitant to discuss because they feel embarrassed or they consider it too much information. How do you feel about that as far as, being a patient that's like embarrassed to bring that up? Because just as a side note, I had a friend today that reached out to me to tell me about, something personal that she was embarrassed to tell her doctor. And I'm like, you should have told your doctor, like what's something, how can we get people to feel more comfortable about, crossing that line of, TMI?
I know, it's so funny. The conversations I have every single day with patients, they'll literally tell me like, I'm sorry if this is too much information, and I'm like, listen, you have no idea what I do all day if you think this is too much information. And I think that I try to break that barrier. Part of the creation of my Her Time of the Month membership was to create that safe space, to create the space where women could ask the questions. Because here's the thing, we don't know, like I said, most women don't know about their menstrual health. They don't know what's going on in our body each month, yet we're dealing with all of these things. Like, we're getting the products for our menstruation. We're possibly buying the Canestin over the counter if we think we have a yeast infection. We're having intercourse and we're getting pregnant, all while not knowing what's going on. And some of these choices can actually harm us, like getting Canestin over the counter. What if it's not a yeast infection? What if it's something else? How do we know? And how do we ask? I often ask women about discharge, and they're like, oh, just I don't know, discharge. Like, they're very uncomfortable about discharge. So part of me, if anyone's ever heard me speak on Instagram stories, I'm talking about discharge. I'm talking about cervical mucus. If you're a fertility patient of mine, I'm talking about these things because it's not TMI when it's going on in your body. And digestion, I find, is one of the biggest taboos. It's like, oh, women don't poo. Well, how do your toxins come out of you then? Like, that's what I'm wondering. And so I just feel like having this open conversation is really, really important. And it's not only important, it's critical to our health. So in Her Time of the Month, every single month, I do my Q&A session, and I'm allowing women to ask these questions, and anonymously if they want. And so we can pose these questions. I have a document where women can submit their questions anonymously. They can still ask questions during the Q&A, but I want to open this up so that they're not stuck telling their friend about their symptoms when maybe their friend doesn't know how to fix those symptoms. And it's all well intended, but we end up giving each other advice that might be harmful for some, and that it's dangerous. And we all know Dr. Google isn't the answer either. So we need to make sure we're getting our information from a credible source.
I love that. And I love that you can also ask anonymous questions too. I feel like that totally makes it like you said, safe and easy and comfortable. So I see that for the new year, you're launching this membership that's tailored to periods. Can you tell me more about that?
Yeah. And so this is the membership that I've created based on giving women this knowledge and this education and the tools. And so basically each month I'm making a recipe guide. So they get a recipe book they can download. There's a newsletter with information. So January, we're talking all about detox and your hormones. And so we're talking about how detoxification impacts your hormones and how your hormones are impacted by detoxification. We're not talking about it in a sense of weight loss and all those things that other people are talking about detox for. We're talking about it with respect to your period. We're talking about estrogen dominance and all of those things. And so we're really kind of wrapping it up in a nice, neat little bow, answering the Q&A, but you also get to download your newsletter that has all of the information with respect to detox and your hormones, my top tips, my treatment options, and more. They're also getting recipe ideas. So I'm trying to help women navigate the kitchen in a way that's going to nourish their hormones and stop with the diet drama, with all of the low carb and the keto and the do I eat this and do I avoid this and I'm still craving sweets. And exactly. And so I want to be able to give recipes that I'm like, these are naturopathic doctor approved. These will help nourish your hormones, but they're also going to help reduce your cravings and help to metabolize your estrogen and all of those great things that are going to reduce your period symptoms. And so making this membership, I wanted to make women's health accessible. So it's only $19.99 a month. And obviously, if you buy more months, you get a discounted rate on that. So I wanted to make sure that this information was accessible to women. So not only do they have my monthly Q&A session where I'm talking about a topic, but I'm also answering all of their questions, but they also get all of these downloadable tools that are available to them every single month. And our members community, which is like the best part of it, because who doesn't love women supporting women?
I love it. I think this is absolutely amazing because I personally feel like the most important thing for a patient is education, and you're giving that. And I think that's amazing that you're doing that. So thank you so much for being so amazing and awesome. And where have you been all of my life? So some of my questions are based on just my personal experience and also, a lot of my close friends or people that I know, so just to kind of present how horribly normal it is that all of these concerns that everyone has. So for anyone who's listening, what they're going through is, not, I don't want to say normal because that's why you're here, but you're here to help kind of like, help work on that to make it, what it should be. Do you know what I'm trying to say? I'm butchering that.
No, I got it. I get it.
You got it. Okay. So I have a friend who gets severely ill during her cycle, and I used to get severely ill as well. And, so I had endometriosis and I've had 2 ablations, which eventually I ended up getting a hysterectomy, but that was for cervical cancer. My friend has not been diagnosed with endometriosis. I know that it's invasive to get that diagnosis because typically it has to be laparoscopic. But she gets horrible migraines and visual disturbances and vomiting along with other PMS symptoms. And this is every month. So, what causes these horrible symptoms and how can others make that just a little bit better? Because if you think about having to deal with that every single month, I mean, it's like you're like disabled for that week of every month. And that's a lot of time.
It's a lot of time. You spend half your month basically in crippling pain or headaches or PMS or whatever the symptoms are. First, I want to say sorry about your diagnosis and what you went through. So that's something that I wanted to kind of sit with first. But with your friend, it's interesting. So first of all, with those migraines, I forget if you told me, oh yes. So is there an aura with those migraines?
Yes.
And so for someone like her, she actually wouldn't be a candidate for birth control, for hormonal birth control. And so really she's then left with not many options in the conventional medical system. Not that birth control helps anything, but or treats anything, but some women find symptomatic relief going on the pill. And so that's the first thing, is having an aura puts you at risk for clots and things like that if you go on birth control. So she's really out of conventional medical options. And now the reason, from an endometriosis standpoint, endometriosis is looked at as an estrogen dominant type condition. So that means that our estrogen is high relative to our progesterone. Now, when we talk about estrogen dominance, and this is something that I'm talking about in her time of the month this month with detox, we're talking about estrogen dominance. The reason why is it's because it's so prevalent. Basically what we're looking at is an estrogen that's either, it can be normal and your progesterone is low, it can be high and your progesterone is normal, or it can be like a high normal and your progesterone is just like not great. That will all put you in a state of estrogen dominance. But let's just circle back and talk about how the menstrual cycle works, just the basics. So we start with, at the beginning of the cycle, this is your follicular phase. So this is when you're building the lining of the uterus, but you're also getting those follicles prepared to send them off during ovulation. And so we have estrogen that's climbing and climbing and climbing, getting those follicles prepped and building that uterine lining. Now, what happens is somewhere around the middle of your cycle, you're going to start to have that cervical mucus, that raw, it's like a raw egg white type of consistency. And that indicates that your estrogen is climbing and climbing and climbing. It gets to a point where we have a trigger. It's called luteinizing hormone. Luteinizing hormone comes up and it picks what's known as that dominant follicle, and it decides that we're going to ovulate it. Once we ovulate that dominant follicle, it turns into what's called a corpus luteum. The corpus luteum then makes progesterone for the second half of the cycle. Progesterone is our progest hormone. So it's going to be pro-gestation, pro-pregnancy. And so it's going to sit and make sure everything is ready and in place for implantation. And then if that doesn't happen, hormones drop, lining drops, we have a period, and it all happens all over again. And so that's what the basic cycle looks like. And so if your estrogen and progesterone are imbalanced, that's going to cause you to have symptoms. And so with endometriosis, if we're looking at like an estrogen dominant type of picture, we have more pain, we have heavy bleeding, we have thicker lining. That lining just builds and builds and builds. And then we have a really thick lining and we have a heavy period. With endometriosis specifically, there's a few different theories as to how it even arises as a condition. But a lot of the theories state that endometriosis may actually be partly an autoimmune condition. The reason for this is because a lot of the theories look at menstrual flow. Basically, endometriosis, for those who don't know, it's parts of the inside of the uterus that are outside of the uterus. So they implant elsewhere and they grow, and that's what causes pain. So depending on how extensively they are elsewhere, how much the growth is, where they are, that's going to cause your symptoms. So some women with endometriosis are silent. They don't really have any symptoms. Others have extreme pain, pelvic pain, pain with sex, pain with bowel movements, pain with urination, obviously pain with periods. It's just a very pain-driven condition because of this. Now, the reason why they look at it as an autoimmune type of issue is because those implants aren't getting swept up and cleaned up by our immune system. There's a reason why they keep growing, right? There's somewhere that they shouldn't be in our body. It's our body's job. It's our immune system's job to clean that up. And so when we don't clean that up, there's some sort of dysfunction in the immune system. So we look at inflammation, we look at immune dysfunction, and we look at estrogen dominance. And those are really the cores as to why we have these symptoms in this presentation. And now the headaches are probably because of that estrogen dominant type picture and that imbalance in estrogen and progesterone in endometriosis. Now, PMS I typically see in those last two weeks before the period, and that's because we have that shift. So if we didn't have a quality egg or we didn't ovulate at all, we're going to have trouble with progesterone that second half of the cycle. We need progesterone to balance out that estrogen. And when that doesn't happen, or there's too much of a difference between estrogen and progesterone, the ratio is off, then we can have symptoms, breast tenderness, acne, irritability, PMS, maybe cramping before your period, maybe spotting between your cycles. And so those are all kind of different factors that play into endometriosis and PMS. And so what can you do to make them a little better? I think it starts with, it depends what's going on. And so it can be an estrogen progesterone issue, but also it can be an insulin issue. It can be a thyroid issue. So we need to make sure that we're looking at everything else. Specifically with endometriosis, we're looking at inflammation. So with somebody who has endometriosis, research has shown a really large correlation between eating things like cruciferous vegetables, broccoli, cauliflower, cabbage, kale, in reducing that pain, that estrogen dominant. But also gluten-free diets have been studied to improve pain in patients with endometriosis. So those are things you can do as simple dietary changes that can help to improve your condition. Now, again, it depends on the extensiveness and all of those things. Diet usually is not enough, but it is something that you can kind of get started doing.
I think that it was interesting that you mentioned, with the auras and the migraines with auras, because that was when mine started. So for me, I was put on birth control at 15, but I wasn't sexually active for years, after that. So it was just simply not for birth control, but for my cycle. And that's when I started getting my migraines with auras. So I think it's interesting that that you said that. And so with, what it sounds like to me is some of these shifts in the hormones are what, women are being sensitive to that's causing these symptoms.
Yep.
So let's talk about, we're going to shift this to weight. That's always a subject that I feel like a lot of us care about.
Yep.
And so I saw on your website that you can also help with weight and finding balance. So first of all, we all want to know, again, where you've been all our life, but, I feel like, personally I'm 36. So we hit those 30s and it makes it a lot harder to maintain weight. And so that's when I feel like a lot of us have to really put in that effort. And especially now dealing with quarantine and life is so different now. So let's talk about that. What do you have to say?
I think it's really important for women to understand that women are not small men. So I think that's something that we need to just like repeat to ourselves, because a lot of the research when it comes to these fad diets, and I'm going to say keto, a lot of the research is done on men. Women are not small men. And the problem I see is I see women working out, eating keto, and then I see them lose their period. And then I see them have thyroid dysfunction. And so we need to make sure that we are not limiting macronutrients. Macronutrients are part of survival. We need macronutrients, and we specifically need healthy carbohydrates for our thyroid. So I'm just going to say that when we talk about weight loss. But there's a few different components we need to talk about with weight loss. We need to talk about, and in my realm of work, the weight gain that I typically tend to see in the fertility and period problem realm is weight of someone who has PCOS or polycystic ovarian syndrome. And now the root cause of the weight gain in polycystic ovarian syndrome is a genetic predisposition of poor blood sugar handling. And so in these women, they have a higher risk of diabetes, they have a higher risk of cardiovascular disease. And the reason why is because of their poor handling of blood sugar. Now, when we look at the testing, a lot of these women don't actually have diabetes. And in fact, I would say probably 95% of my patients don't have diabetes. But what they do have is a high fasting insulin. And so insulin is something that we miss when we're looking at weight in general. When we're looking at weight loss, we don't look at fasting insulin. And so what insulin does is it stores. It's our storer. It helps us build muscle, but it also helps us store fat. And so if our fasting insulin, when we eat something, we are not fasting. Our insulin kind of comes up from our pancreas, causes our blood sugar to be stored. But when we're fasting, that insulin should be down. When that fasting insulin is high, we are storing. And so that is something that women need to take a look at, is fasting insulin. Another piece of the puzzle is thyroid. Getting a full picture of the thyroid is really important. And by that, I don't mean just TSH. TSH and T4 are not enough to determine if you have a thyroid issue. We need to look at a full thyroid panel, which includes T3, it includes antibodies, because a reason why you can be gaining weight or having trouble losing weight is because of a stubborn thyroid. And guess what? Someone who has an underactive thyroid who then decides to work out harder and go keto is going to be in a lot of trouble, because we need those healthy carbohydrates and we don't need that intense exercise. We need maybe slower and lower exercise. And so looking at the thyroid, looking at fasting insulin, and making sure that everything else is balanced to make sure that we can actually figure out what the root cause of the weight gain is. It's not all about calories in, calories burnt. Having said that, exercise and movement is obviously important, but we need to look at it in a way that fosters balanced stress hormone. So if we're just working out harder and lifting heavier and expecting to lose weight, that's not going to happen. Because when we do this, we throw in another hormone, and that's our stress hormone, cortisol. We are also in a global pandemic, and our stress hormone is higher than we might think. And so with our stress hormone being high, again, our body is protecting us. When we are stressed, our body believes we're running from a bear. Even if we're sitting at a desk, fighting with our partner, fighting with a friend, we are running from a bear. Our epinephrine, our norepinephrine is up. That is our adrenaline response. We are ready to run from that bear. And so you have to think about what our body would do while we're running from that bear. It's going to stop reproduction. We might lose a period. We might miss a period. We might not ovulate. It's going to store our body fat where our most important organs are. Our gut. We need to make sure we're protecting our body. We don't care about our arms and legs. We don't care about our digesting food. We are running. We're protecting our body. We're protecting our core. We're bringing blood flow to our muscles, away from our brain, away from everything else that we need at our desk. And we're running. And so part of that is weight gain. And so I see this a lot in women going through that menopausal, perimenopausal stage, because what's happening is your hormones were once made a little bit by your adrenal glands, your stress hormone glands, and a little bit by your ovaries. Once you go through menopause or that perimenopausal stage, once your ovaries are finished doing their job, that job falls all on the adrenal glands. And guess what? You're running from a bear. Your adrenal glands don't care anymore. And so they're not focused on giving you any sex hormone. They're giving you stress hormone. And so again, we see women in that perimenopausal stage, getting that, we call it the spare tire around that midsection, right? We all know about somebody who complains about their spare tire or their muffin top. And that's that cortisol response. So we need to look bigger. We need to focus on a whole foods diet, Mediterranean style, not limiting macronutrients, but we need to look at the root cause: insulin, cortisol, thyroid, as part of that picture. We also need to factor in sleep. Are you sleeping? Because if you are not sleeping, you are not going to lose weight. And so women are not small men. We are very complex. We have a lot more hormonal things going on. And so we cannot translate the things that men do to lose weight and try to do it ourselves. Far too often, I see women working out too hard, like I said, not sleeping, drinking way too much coffee, taxing their adrenal glands. They might be new moms. They might be trying to lose that baby weight, and they are stressed to the max. They are overwhelmed, and they're eating 1,200 calories a day. Your body is in starvation mode, and you will not lose weight.
Well, and even for those who do have success losing weight that way, it's going to come right back, or you're going to have other issues. I'll see pictures of people at the gym who are posting with their photos and they have like bruises all over and they say, oh, it's from the weights, I'm working out hard. But I mean, that's obviously a sign of iron deficiency. So I love that. I love this topic so much. We could do a podcast episode on this topic, all like diet culture. You know, I just feel like it's so harmful. So I love all that education that you just shared. And I think that's so important, especially now where, you know, keto is such a popular thing right now. You know, so I truly have always believed that if you just eat clean and, you know, you don't have to do the calorie counting and you don't have to do all of that hard work, you know, as long as you just eat clean, get moderate exercise. But yeah, my problem is sugar. Now, speaking of sugar, like, so sidebar, is that like something that could be related to the hormones?
Yeah, I've actually seen research that women are more interested in sugar and refined carbohydrates in the second half of their cycle. And I've also found that the estrogen levels are inversely related to our satiety hormone, so our ability to feel full. But on the note of sugar specifically, a lot of people are really hard on themselves when it comes to like, oh, I can't kick sugar, I can't get rid of sugar. But the fact of the matter is, sugar is a drug. Your brain responds to sugar the same as it responds to cocaine. They've done these studies in rats. And so I always notice in myself, even if we go through a holiday, if we go through Thanksgiving or we go through Christmas, and I've indulged, I've eaten sweets, I've eaten the pie, I've done the things. For the next few weeks after, I am craving chocolate or something sweet every single night. When I kick that, when I'm done doing that and I decide, all right, I'm not doing that anymore, you get to a point where you get over it, but there is a little bit of a withdrawal phase that you need to just make sure you're eating lots of fat, lots of fiber, lots of protein to kick those cravings, because it is a drug. It does respond like a drug. And so we do need to be a little bit easier on ourselves. I notice it after every holiday: Easter, Halloween, right? Anytime you have the ability or the capacity to indulge in sweets, thereafter for a few weeks, you're like trying your best to like not think of chocolate all day.
Every day. So one of my friends had a question, and it was, why is it so damn hard to get knocked up?
Yeah, I mean, on a good month, your chances of a successful conception are about 20%. Now, pair that with what I said at the beginning, that most women don't know anything about their cycle. They don't know when they ovulate. They don't know what ovulation means. They don't know what their cervical mucus means. And so therefore, they don't really know when to have sex to get pregnant. And so take that 20% chance, pair it with not also understanding your body, which most women don't. It's not their fault. They weren't told. And that really makes it difficult to get pregnant for some women. When we look at things like apps and our trackers and things like that, a lot of women go by their apps blindly. And the fact of the matter is, their app can be wrong. Your app is just a calculator. Your app is saying, okay, so your cycle is 28 days. That means that 14 is where you ovulate. And then they take a couple days before and a couple days after, and that's your fertile window. It has nothing to do with what's actually going on in your body when you're actually ovulating. And so I think that's why it's so difficult.
Yeah, it's a lot. And then plus, like you discussed earlier, just any underlying conditions.
Yeah.
Um, so I had another question too. That was, I have someone that is working on in vitro, and she only has one, she only was successful with one egg. And of course, IVF isn't cheap. So she's going to be trying that, here next month, and basically with this one chance. And, the question was, if there's anything to optimize implantation. Otherwise, she has to start over. And, so for anyone who's going through IVF, do you have any suggestions with that?
Yeah, I mean, depending on the timeline we have, usually when we do IVF, so she's done her retrieval, now she's doing the frozen transfer.
Mm-hmm.
Yeah, and I mean, so depending on our timeline, we do a lot more. So usually I'm running full blood work in patients, making sure that there aren't any underlying reasons why they would miscarry or that it wouldn't take. Is it a sperm quality issue? Is it an egg quality issue? Is there a thyroid issue? Making sure that everything is kind of as balanced as possible when it comes to the blood work. I look at vitamin D specifically. Running vitamin D in the blood work can be really helpful. There is some research when it comes to probiotics, improving the success rates of IVF. Acupuncture is really, really great before and after transfer, and making sure that your diet is as good as possible. I mean, again, that insulin I spoke about, balancing your blood sugar, moving your body moderately, making sure that we are optimizing for that balanced blood sugar. But yeah, like acupuncture can be a really great tool as well.
I love that. That was some good info. So how about after stopping birth control? I have a lot of people that want to know how long it takes to be able to get pregnant, because I know that can have, I know some people who have been on birth control, since their teens for years. And I know that can have some type of an effect on your body after.
Yeah, here's what we know about birth control so far is we know that whatever you were put on birth control for is going to still be there when you get off. And so what that means is if you were just a person who got put on birth control, you had regular cycles and it was for birth control, and you come off, you could ovulate right away and get pregnant right away. If you went on birth control because you had irregular periods and it was PCOS and you had issues ovulating, then you come off, you're still going to have PCOS. And so I think it's more of a matter of why you went on, how long you were on, and what your cycles look like now. It's completely normal to not ovulate the first few cycles after coming off of birth control. Your system has been completely shut down. Your body's learning how to ovulate again, because that's the whole point of birth control. We turn off ovulation. We turn off our ability to naturally ovulate. And so our body's getting used to that again. So some women can get pregnant. Like you hear the stories, they got pregnant the first month. Other women, they don't ovulate for a few months. Other women who had PCOS or anything else that came up may not ovulate for a while and may actually need to go into fertility treatments. And I think the main thing we have to ask ourselves is, can we prevent having to go into fertility treatments, or could we put these people in fertility treatments sooner if we were to get off of birth control, figure out what's going on so we can intervene before it's time to, oh, I want to have a baby next month, I'm going to go off birth control this month.
Yeah, I think that was well said, especially, I never even thought of it that way, like the reason you went on and how that can connect with when you get off, like what the plan or what might be going on in your body. That was like, this is all just so mind blowing. And it's simple that when you think about it that way, but then we just don't think of it that way. It's just kind of like, well, all right, what's going on here?
Yeah.
So one last topic I wanted to discuss was postpartum.
Yes.
I think that's such an important topic. I personally dealt with postpartum. I never got officially diagnosed after, having my children, but it was something that I dealt with undiagnosed for many years, and it affected me for a long time. And it wasn't until like years later, after getting through and healing and all of that I realized like that was definitely just part of it, just that imbalance. So anything that you want to bring up that you think would be important to educate others as far as postpartum goes?
Yeah. So we're talking postpartum depression and anxiety, correct?
Yes.
Yeah. So I think the postpartum period in general is very much overlooked. 6 weeks is not enough time to make sure that we're doing okay. And it's kind of like I've said this to, I think I've said this to 3 patients today, but it's like you're pregnant and everyone's like, how are you? How are you feeling? Are you okay? Baby comes out and you are just no longer a thing that anybody cares about. You do your 6 week checkup. They're like, yeah, it looks good. You're okay to have sex. Okay, have a good day. And really that's about it. I find a lot of my patients, most of my patients don't have blood work done in their postpartum period. Most of my patients aren't assessed for really anything. And so when you're suffering, especially if you've had a baby in this pandemic, you're alone and you're feeling the feelings that you are feeling and no one is checking in on you. And I think it's really important that we talk about it. A couple things to make sure that you have done: looking at your thyroid levels, looking at B12, testing your vitamin D, testing your iron, because there can be other reasons why you're feeling low and why you're feeling down. And there is a normal period of baby blues, but I think that we really need to start talking to moms more, because a lot of women suffer and we don't find out until years later. I think there's a huge culture, especially with being at home. The only space that you're seeing people is on Instagram and social media. And there's this facade of this is my highlight reel. But when you're dealing with postpartum depression, someone's highlight reel feels like their everyday life. And I found becoming a mom myself, I found that to be really, really intimidating and really overwhelming. My son is 14 months old, and the amount of times that I've felt inadequate, I can't even count. The amount of times that I've felt mom guilt for not even doing anything, but just not being the person that I thought I would be being a mom. I look at a lot of women, and I'm guilty of it myself. I look at a lot of women on Instagram in admiration. I'm like, how do they have 3 kids? I can't even deal with one. My son's crying and I'm anxious, and my son's crying and I'm overwhelmed. And I think a lot of women are worried and scared. And I have friends and I have colleagues who have babies, and they act like everything is amazing. And I feel like we need to have these conversations. Being a mom is hard. And it doesn't mean you're a bad mom because being a mom is hard. Just because you would rather your child be elsewhere when they're screaming and crying and you're trying to get your work done, that doesn't make you a bad mom. And I think we correlate it so much, all these good moms, and everybody is actually suffering silently when we could be having this conversation together.
I think that's such a great point, because, when we look at the highlights and on Facebook or Instagram, that's the only thing that most of us do show are the cleaned up pictures. And, like even here right now, as I'm talking, you can't see the mess on my table right here. It's not in the shot, so
this is why I have this background. You don't see toys everywhere. Yeah,
exactly. So, it's so important to remember that what we're seeing is just kind of like a doctored up, dusted off, cleaned up version of that. And people aren't showing them hiding in their bathroom crying, or like taking that extra long poop for that silent time, or, life is hard for everyone, despite how, beautiful and balanced and perfect their life is on Instagram.
Yeah.
So let's go ahead and wrap up with any last things that you want to discuss, and then also how everyone can find you, which will be included on the blog for the episode notes as well.
Yeah, I don't know. I feel like we've hit a lot of topics. I feel like we could do a full episode on any of these
topic.
Yeah. Because it's a lot of information. If anyone has any questions, feel free to reach out. I'm quite active on Instagram, so if anybody has questions, send me a DM. You can find me at Dr. Laura ND on Instagram, and my website is www.laurapfeiffer.com. But you can also find that on my Instagram. So that's probably the easiest way to reach out.
Awesome. And yes, definitely get on her Instagram, because it's amazing, and so many easy, to watch quick, short little bits of great information. So to have that come into your feed regularly is awesome. So thank you so much. I appreciate it.
I appreciate being here.
Please be sure that you subscribe to the blog, which is bluedreamhealth.com, where you can find additional links and information on this episode. You can also check out the digital magazine on our website, as well as find us on Patreon, where you can be a supporter.